In gastroenterology, we work as big teams with other specialties. So quite often my patients see a rheumatologist, they end up getting eye exams. They see multiple providers, and the difficulty has always been communication between the providers, because normally, somebody would copy into a clinic letter and you'll get the clinic letter and get up-to-date results on the patients. But that doesn't always happen. And so there can be gaps in the care. And it's really important that everybody understands what's being prescribed, because one drug might be good for my area in gastroenterology, but not be beneficial in their areas. There are side effects of drugs that I think we all need to know about. But probably most important is when we are not in our office and a patient gets sick, they go to the hospital, get seen and emerged, get admitted under various providers. And unless those providers can see what we've been planning, who's been looking after them, what their drug history is, it really is bad for patient care. It really, mistakes get made, bad decisions that we know doesn't work in patients get reiterated, and it just leads to disasters. So I think communication has always been the backbone of good patient care. And when you have a information technology system that's very fragmented, pieces don't communicate with one another, then patients fall through the cracks, and important clinical decisions that have been made are not appreciated by others, and that leads to poor patient care and poor outcome. But I think probably the biggest part for us is the interaction with Emerge, because they immediately know who's involved in this patient care, who to contact if they present to the emergency room. And it's worked well, because at present, if my patients go to Emerge, I'll get a call from the emergency room physician and say, hey, I see you've been treating this patient, they've come into this, what do you think? Normally that patient would have been referred to inpatient gastroenterology. They would not know what I've been doing. And it just makes a prolonged admission. You spend more money repeating things that's been done in the past. So I think overall, it's about communication.